We're here today really to just tell you a little bit about the experience we've had with the Bedfordshire Chronic Fatigue Service. Yeah, I've had chronic fatigue now for like 10 years.
I've had ME for 3 years. My concentration levels got really poor. I couldn't see the computer screen.
I've had ME since about 2006. I initially got unwell in about 2005 when I went on a trip to Peru and contracted some kind of stomach virus.
For a relatively small area, there's perhaps in the order of 1,000 patients, maybe a little more than that, in Bedfordshire with chronic fatigue. So how can you better help this relatively small but nevertheless quite disabled group of patients best return to the highest level of function that they can possibly do? And the way to do that was to sort of try and replicate some of the gold standard models that are currently out there, the ones being used in London, and we thought, well, we can do that.
When people come in for assessment, they will initially see Dr. Stodell, our consultant physician, and Sue Wilkins, our cognitive behavioural therapist, who will look at people's physical needs, symptoms, and also their mental health needs. And then following this assessment, the person will be seen by Katrina Wilkins, our physiotherapist, and myself as an occupational therapist.
But having a service that covers that area means it's been really, really helpful.
Yeah.
Because before that you feel like you're out on a limb and there's no one to turn to.
Professionals, they know what they're doing. They know exactly what the condition is. That's the point.
I think having a multidisciplinary team makes this service more accessible, because not all patients are ready to consider the emotional element to this problem. And so you'll find some patients that wouldn't even have gone to a clinic that provided only CBT. They would never even come for an appointment. So at least here, you've got the different disciplines, you've got emotional and physical practitioners. People are much more likely to engage, and if they can engage with one, it might be that they come round to the idea of thinking about the psychological.
And then it just got better, really. I think having found these professionals with understanding of all aspects of the illness, the psychological effects, the poor concentration, the fatigue, their understanding of it, and has helped me make more sense of how I manage it. And what types of things I do during the day.
That we can refer into each other. So often there's so much crossover with all the disciplines. So from my point of view, trying to get people to change from a physical point of view is really, really, really difficult sometimes, particularly if they've been fatigued for a long time and there's a lot of fear avoidance, there's a lot of barriers to the change. And that's where I can then refer them over to, say, one of the psychologists or a CBT therapist, and they can help deal with those barriers to the change. She can then send them back to myself when those barriers have been addressed, and then my graded exercise therapy part will be much more effective because they'll be able to make that changes. So that's where it's so much easier that we can send them off to each other profession, so there's a much more coordinated approach.
I was going to say, because there's no standalone clinic in Bedfordshire until we were set up, but I didn't have the opportunity to work alongside a physiotherapist or an occupational therapist or a consultant, and actually have communications weekly with the consultant and just say, can I just flag this up, and is this likely to be an issue, or and I think that's really beneficial because we get that whole round approach, and we can feel more secure in what we're offering as well for the client.
My initial concerns about coming to the service here was that it wasn't St Bartholomew's. It was better because I didn't have to travel to London, where the St Bartholomew's Hospital is, and this is practically on my doorstep, so that was a huge benefit.
I've been most encouraged, although I've done some combined clinics with orthopaedic surgeons, for example. I've never worked in such a truly multidisciplinary way, and it's a very stimulating service to be involved with.
It has been a life-changing experience for me. If there were a series of buttons in front of me, every single one of those buttons has been pressed by that team. They have really turned around my life, and I genuinely have a real future now again.
I would highly recommend that anyone with CFS or ME, both being the same condition, just with different names, access this service and get referred here. It will significantly change their life for the better.